forms of airway adjuncts, which is a Oropharyngeal airway, or a Nasopharyngeal airway. Airway adjuncts simply work by lifting the tongue off the back of the throat in order for the patient to be able to breathe a little bit more effectively. An oropharyngeal airway is used for a patient who is unresponsive and does not have an intact gag reflex. If you do stimulate a gag reflex, immediately remove and clear the airway as needed. In order to place a oropharyngeal airway, we first must measure it. We do this by measuring it from the corner of the mouth to the tip of the ear. They do come in different sizes. For instance, this is for an infant or for a much larger adult. In order to place this in, we actually put it in the backwards position and rotate it to 180 degrees. In order to do this, we must first do a cross finger technique using our thumb and index finger. Placing our thumb on the lower teeth, index finger on the upper teeth. We simply pull back, insert this way, and rotate 180 degrees. If correctly placed, this should be flush up against the patient's lips. You may also insert it by coming in sideways like this and rotating it just a quarter turn. Either way is acceptable. The nasopharyngeal airway, or nasal trumpet, can be used on a patient who is responsive and does have a gag reflex intact. This will also help to maintain an airway. Although we may use the nasopharyngeal airway on a patient who is fully alert and oriented, it may be a little uncomfortable, and is typically used for someone with a decreased level of consciousness. Before placing this device, we also must measure it as well. In order to do this, we measure it from the nair, or the nose, down to the tip of the ear. This device will fit appropriately. Before inserting this device, we must lubricate using a water-soluble lubrication. If you note, there's a bevel on a nasopharyngeal airway. The bevel, or the cut, the sidewards cut in the nasopharyngeal airway, is designed to go towards the nasal septum. Typically, this is inserted initially into the right nair, or whichever nair is clearest. It doesn't matter which one you use, but this is typically designed that the bevel is in optimal position when we're inserting it in the right nair. So, bevel towards the septum. Left nair is going to have to go backwards to get the bevel towards the septum. Once we're ready to insert this device, put it into the right nair, bevel side in, and just lightly just push it right down. If we meet any resistance, we stop what we're doing and remove it. Remove. And then we're to insert it into the left nair, bevel towards the septum, and as I go in, I'm going to rotate it into its natural position.
Up first.
That's the wrong way.
You can turn around. Slide it on down. If it's coming out. If it's coming.
Yes.
Both the nasopharyngeal airway and the oropharyngeal airway can both be utilized as airway adjuncts in order to maintain an open, clear airway.